The top stories tonight in Y News. President Rodrigo Duterte meets with the Interagency Task Force against COVID-19 tonight. He is expected to announce later the community quarantine classifications that will prevail all over the 16 cities and 1 municipality in the National Capital Region and in 4 neighboring provinces. Meanwhile, several cabinet members are now in self-quarantine. A group of Filipino researchers say they have discovered a new strain of SARS-CoV-2, the virus that causes coronavirus disease 2019, which they say is more infectious. But the health department has yet to expound the discovery.
We still need a lot of evidence for us to say na talagang mutated na yung virus at nandito, yan yung kumakalat sa ating bansa.
Metro Manila mayors recommend to place the National Capital Region under general community quarantine. Philippine Red Cross to suspend COVID-19 testing if PhilHealth fails to settle balances amounting to 700 million pesos.
New Zealand records 9 new COVID-19 cases, all from Auckland cluster. The New South Wales government in Australia apologizes over a cruise ship outbreak. Good evening, Philippines and the world. Today is Monday, August 17, 2020. I am Herlene Delgado.
Join us in the next hour as we deliver today's top stories around the country. I am Angelo Castro III.
And I am Elsie Marcos here in Auckland, New Zealand, bringing you what's grabbing the headlines in other parts of the globe.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. First in the news, President Rodrigo Duterte meets with the members of the Interagency Task Force against COVID-19 tonight. The president is expected to announce later the community quarantine restrictions that will prevail all over the 16 cities and 1 municipality in the National Capital Region and in 4 neighboring provinces. The NCR, Bulacan, Rizal, Cavite, and Laguna are under modified enhanced community quarantine until tomorrow, August 18. Presidential spokesperson Secretary Harry Roque last week announced the community quarantine classifications in the rest of the country implemented until the end of August. Tonight, the Filipino nation awaits the president's decision on whether Metro Manila and its 4 neighbors will remain under MECQ. Will restrictions be relaxed or further tightened? Meanwhile, several members of the president's cabinet are in self-quarantine. Here's why from our Malacanang correspondent, Rosa Licos.
Interior Secretary Eduardo Año has contracted coronavirus disease 2019 twice. He took a swab test and decided to self-quarantine after experiencing symptoms Thursday last week. That's why other cabinet members who had come in close contact with him have also decided to undergo self-isolation and swab tests. That includes presidential spokesperson Harry Roque. The last time the cabinet members were physically together was during a meeting with President Rodrigo Duterte in Davao City on August 10.
At binabuti na po namin mag-self-quarantine ngayon, no? Ito man po ay 5 araw tapos kami po ay magpapa-PCR test para naman makabalik na sa trabaho, no?
Malacanang, however, ensures the Philippines' chief executive remains healthy and well. This comes amid reports that the president has gone out of the country for medical reasons. He is expected to meet with the IATF and his cabinet members through video teleconferencing tonight. The palace denies that the president had close physical contact with Secretary Año or with any of the cabinet members, although he met with the Interior Secretary Monday last week.
He's in perpetual isolation in the sense that PSG has done a very good job in making sure that no one really comes close to the president.
Rosa Licoz, UNTV, News and Rescue. We serve the people, we give glory to God.
The Health Department slams what Attorney Larry Gadon believes that wearing a face mask cannot prevent the spread of coronavirus disease 2019. The DOH underscores this preventing measure is not a joking matter. Attorney Gadon was seen with his surgical mask taped inside his face shield instead of securely covering his face. This has gone viral online. The DOH explains people could be protected 99% from COVID-19 by wearing a face mask, a face shield, and observing proper physical distancing.
Nakakaawa no yung mga healthcare workers natin na may isang kung sakali na magkakaroon ng pagsunod ang mga tao dito sa mga sinasabi nitong si magkakaroon ng parang false sense of information pa, misinformation, baka sumunod yung mga tao, hindi nila gawin, magkakasakit sila, and sino ba yung huli na sasalo sa mga nagkakasakit? Yung mga healthcare workers natin ngayon na are really suffering already.
Labor Secretary reiterates that if workers undergo a swab test, it shall be at no cost to the workers. Secretary Silvestre Bello III, in a statement today, clarifies that on the requirement for RT-PCR tests for workers and employees in identified industries, the new protocol makes it mandatory only for personnel with symptoms of the virus that causes COVID-19. He says that for asymptomatic workers and employees, undergoing swab test is highly encouraged. And in both instances, the test shall be at no cost to the workers. The COVID-19 test requirement is stated in the DTI and DOLE supplemental guidelines on workplace prevention and control of COVID-19, which took effect Saturday. Identified to undergo RT-PCR test are workers in the tourist zones, local manufacturing companies, transport and logistics, food retail, education, financial services, non-food retail, services, public market, construction, water supply, sewerage, and waste management, public sector, and mass media. Employers are encouraged to collaborate with the national and/or local government testing efforts like drive-through or walk-through testing facilities. The joint memorandum circular shall apply to all private establishments regardless of economic activity. A new strain of coronavirus is detected in Quezon City by researchers of the Philippine Genome Center. According to experts, they believed it is more infectious compared to the first discovered in the Philippines. But according to the Department of Health, they still need to find more evidence to prove that this is the same strain which can be found nationwide. Our health correspondent, Aiko Miguel, reports why live. Yes, Aiko?
Yes, Harleen, researchers of the Philippine Genome Center have discovered a new mutation of the SARS-CoV-2. Based on their journal published on August 13, they have come across traces of the new strain known to be G614, which they believe is more infectious. When COVID-19 was first detected in the country last March, researchers found a D614G variant in samples that genome experts collected. But when they conducted a new research in June, they detected G614 in some positive cases in Quezon City. According to the Department of Health, Harleen, they are still studying this new discovery. In fact, according to Health Undersecretary Maria Rosario Vergere, they still need a lot of evidence for them to say the virus that causes COVID-19 has indeed mutated and is present in the country. However, experts and even the DOH clarify that although they have discovered a new strain of the novel coronavirus in Quezon City, it does not mean this is the same strain which can be identified nationwide. And Harleen, just a quick update on Interior Secretary Eduardo Año's condition. The DOH is also studying whether the virus detected in his swab test was just remnants of the virus which hit him previously. The DOH is also currently in talks with the Technical Advisory Group of Laboratories to determine what really appeared in Secretary Año's swab test. The health department is considering the sensitivity of the RT-PCR test while it detected COVID-19 in the samples from the DILG secretary. They are also comparing this with his first test, which found him positive but asymptomatic. The DOH will release an update once the result of the study is out. Here's what Undersecretary Vergeres said today.
We are getting the details from the laboratory na pinagtestan niya, and we are getting the specific CT values. No? Ito yung mga medyo highly technical sa laboratory which will show kung talagang contamination lang o talagang positive talaga. No?
Harleen?
Aiko, can you give us some updates on the Avigan drug clinical trial which is underway in the Philippines?
Yes, Harleen, 100 COVID-19 patients in the country are participating in the Japanese anti-flu drug Avigan, which started today. Those who are qualified to be part of this search for cure are 18 to 74-year-old COVID-19 patients with no coexisting bacterial infection. That means only SARS-CoV-2 is infecting them while the trial is ongoing. The Japanese government has sent 199,000 Avigan tablets, which Prime Minister Shinzo Abe has voluntarily given to the Philippines. Improvement was seen in Japanese COVID-19 patients administered with Avigan. According to the DOH, Harleen, the trial will run for 9 months, starting with 4 hospitals. The 4 hospitals are the University of the Philippines, Philippine General Hospital in Manila, Santa Ana Hospital also in Manila City, Dr. Jose N. Rodriguez Memorial Hospital in Caloocan City, and Quirino Memorial Medical Center in Quezon City.
We will start with these 4 hospitals, but of course, mag-expand pa yung list of hospitals na yan for us to be able to have these 100 patients na sinabi na allocated na drugs coming from the Japanese government.
Harleen?
So, Aiko, just to clarify, what happens after 9 months of clinical trial on the Avigan drug?
After 9 months, the DOH will report the results of the clinical trial to assure whether the Japanese anti-flu drug helped improve the condition of COVID-19 patients who participated in the Avigan clinical trial. Harleen.
All right, thank you so much, Aiko Miguel, for that report. Meanwhile, the country's Department of Health says that 3,314 new cases were reported today based on tests done by 91 out of 105 laboratories. The National Capital Region logs almost 2,000 new positives. All 4 other areas under modified general community quarantine, aside from the NCR, input the most number of new cases. That raises the total confirmed cases of coronavirus infection in the Philippines to more than 164,000 today. The country's total active cases has lowered to just more than 49,000. Of those active cases, 91.1% are in mild condition. According to the DOH, 93 duplicates were removed from the total case count. The total number of individuals in the country tested so far is more than 1.9 million. We have lost 18 more patients. But through our fervent prayers, medical interventions, and sacrifices of our medical frontliners, 237 more people have won their battle against the invisible enemy. That brings the total recoveries nationwide to 112,759. Thanks be to God.
Let's now take a closer look at the updated count of coronavirus cases around the world. The COVID-19 pandemic has now reached a total of over 21.6 million confirmed cases in 188 countries, regions, and sovereignties. That's after more than 234,000 new cases were recorded in the last 24 hours from various countries. Cases in the Americas account for more than half of the total global count at more than 11.4 million. The fast-spreading disease has claimed over 775,000 lives. While close to 13.7 million patients across the globe have recovered from the new coronavirus infection. Thanks be to God.
More than 400 Filipinos arrived from Lebanon where a massive explosion that occurred early this month. The country's Foreign Affairs Department, led by Secretary Teddy Locsin Jr., welcomed our 410 fellow Filipinos who flew in on board a DFA chartered flight. According to the DFA, this is the first in the series of repatriation flights organized by the DFA since the explosion at the Lebanese capital Beirut on August 4th. The DFA also says the arriving flight includes the remains of 8 overseas Filipinos, 4 of whom were killed as a result of the blast.
The mayors in Metro Manila recommend to place the entire region under general community quarantine, but they say they will let the Interagency Task Force decide on this, and they will abide by the IATF's decision. Joanano tells us why.
Presidential spokesperson Secretary Harry Roque confirms that the Metro Manila mayors have recommended to downgrade the National Capital Region's community quarantine status to a more relaxed general community quarantine. However, this GCQ will be similar to the version implemented in June, which is much stricter compared to current one.
So perhaps I can confirm na ang recommendation din ng mga mayor ay GCQ, pero yung GCQ po nung buwan ata ng Hunyo na mas mahigpit kaysa doon sa eventual na GCQ na pinapatupad ngayon. At yan naman po ay pinakinggan ng mabuti, ng masusi ng IATF at in-incorporate po yan sa kanilang rekomendasyon kay Presidente.
Although they have recommended to revert Metro Manila to GCQ, the local chief executives will still let the IATF to decide on the new quarantine restrictions. They also vow to comply with the IATF's decision, saying that all quarantine restrictions have positive and negative implications both on the economy and on health.
Based naman dun sa pinagmitingan nga namin, if ever mag-MCQ tayo, mas makokontrol natin ang labas ng tao. At the same time, yung ekonomiya naman medyo magsasuffer kasi kukonti makakalabas, kukonti makakatrabaho, kukonti ang pumunta sa mga establishments para gumastos. Ngayon sa GCQ naman, may public transportation, mas makakatulong tayo sa mga manggagawa natin na pumapasok.
According to the Metro Manila mayors, there are some significant developments that happened as we reverted to MECQ, wherein the localities were able to test and isolate COVID-19 patients. However, they also admit that the lockdowns have greatly affected the economy and that some local government units are struggling to sustain the needs of their people. Meanwhile, the Filipino Nurses United complains there was no hiring of additional health workers that happened during the 2-week MECQ.
Wala ho talagang substantial na pagbabago. Kasi ganun pa rin po yung inire-report sa atin ng ating mga kasamahan. Kulang pa rin po ang kanilang mga PPE. Ang personnel din po ay hindi naman po nadagdagan at ang pinag-uusapan lang po ay kung paano dagdagan ang bed sa bawat ospital na i-allocate sa COVID-19 pero hindi ho kasamang na pag-uusapan ang dagdag na personnel.
Malacanang, on the other hand, reiterates that the IATF is doing all the efforts to strengthen our hospital capacity as well as improving our healthcare system against COVID-19.
So far po, hindi naman po lumalala ang ating case doubling rate. Naibsan po yung ating critical care capacity pero mga nakalipang araw, hindi naman po siya nasa danger level, no?
Joanano, UNTV News and Rescue. We serve the people, we give glory to God.
Quezon City could spend less for RT-PCR tests soon, thanks to the city government's joint efforts with the private sector. Vincent Arboleda will tell us why.
The number of COVID-19 infected individuals in the Philippines continues to rise. With the aim to stop the spread of COVID-19, a faster turnout of reverse transcription polymerase chain reaction or RT-PCR test result is needed. That is why the Quezon City government is set to open its own molecular laboratory as one of the measures to detect the virus and stop its spread in the community. The molecular laboratory has the capacity to conduct 500 tests per day with a turnaround time of 1 to 2 days. According to Joseph Huico, head of the Quezon City COVID-19 Task Force, aside from the fast turnaround, the QC government can lessen the cost of testing as they no longer have to pay for it to private hospitals. Based on previous reports, a single RT-PCR test, the gold standard for COVID-19 testing, costs around 3,500 pesos to a little over 8,000 pesos each, an amount the QC government could attenuate by putting up its own molecular lab. 20 personnel from the City Health Department, including medical technologists, pathologists, and lab managers, will undergo training at the Research Institute for Tropical Medicine, or RITM. Other than COVID-19 tests, the molecular lab can also process tests on tuberculosis, HIV, and dengue, among others. Quezon City Mayor Joy Belmonte thanked the private sector for providing funds to put up the city's own laboratory. The molecular lab has already secured a DOH accreditation for a Level 3 laboratory. Once approved by the Health Department, the QC government plans to open the molecular lab in the last week of August. Vincent Arboleda, UNTV News and Rescue. We serve the people. We give glory to God.
San Juan City Mayor Francis Zamora defends that he and his family are not quarantine violators. One of our senior correspondents, Joan Nano, is back to tell us why.
Following reports on alleged violations of quarantine protocols, San Juan City Mayor Francis Zamora clarified that he and his family have undergone swab testing, which turned out negative for COVID-19. The local chief executive also stands firm that he and his family did not violate quarantine protocols. The reports came out as 9 staffers working for Mayor Zamora turned out to be COVID-19 patients 10 days ago, the local chief executive claims. 5 of them are working in the mayor's house, while 4 others are part of his staff at the City Hall.
Noong mga panahon na yon, ako po ay nagpa-test gamit ang PCR machine, hindi lamang isang beses, ngunit 2 beses sa loob ng nakaraang 8 araw. At ang aking resulta ay parehong negative. Wala po tayong nilabag na anumang protocols.
Mayor Zamora explained that when the test results of his staff came out, they were immediately brought to an isolation facility within San Juan City. He added that he informed the chairman of the Homeowners Association of the community where the Zamoras are residing and denied that he did hide the fact from their neighbors.
It was reported to them by the City Health Office and the barangay. In fact, kausap ko kanina yung mismong chairman ng North Greeners Association. Base sa aming usapan, wala naman hong ganitong issue. Sapagkat sila naman bilang board, specifically him as the chairman and as the head of the security committee ng North Greeners, kung saan ako nakatira, aware naman siya na meron na positive sa amin. Aware din siya na na-pick up na ito ng aming City Health Office at aware din ho siya na ilang araw na kami paulit-ulit nagsasanitize, nagdi-disinfect ng aming tahanan.
The local chief executive adds that the house was not placed into lockdown as the City Health Office assessed there is no need to do so. He further defended there was nothing wrong when he accompanied his wife to do the grocery last weekend. Joan Nano, UNTV News and Rescue. We serve the people, we give glory to God.
Manila City has installed a new covered walkway from Pedro Hill up to the Taft LRT station. Pedestrians will enjoy its lights at night. This newest installation is a joint project between the city and Robinson's Malls Manila. But when outdoors, be sure you are off to an essential activity to avoid sanctions.
Some senators question the assignments of the members of the Interagency Task Force for the Management of Emerging Infectious Diseases, or IATF-EID, to monitor local government units in Metro Manila and neighboring provinces with high incidence of COVID-19 cases. Senator Risa Hontiveros filed a resolution today seeking a Senate inquiry on the matter, which she calls toxic micromanagement. According to Hontiveros, the IATF members are not experts, nor do they have any experiences in health system performance, critical care capacity and surveillance, isolation and and treatment protocols. The lady senator claims there have been reports from the ground that reveal some IATF members interfere even until the barangay level. She adds the IATF should let the mayors work because they know better what to do in their respective localities. The lady senator further adds there is no basis for the supposed interference of the cabinet members and that the IATF should just focus on their mandate, which is to craft effective strategies and policies. Meanwhile, for Senator Kiko Pangilinan, the national government should stop micromanaging its COVID-19 response. In a statement, the senator says having cabinet members play Big Brother to local government units is a form of mismanagement that may further slow the government's COVID-19 response. He adds the national government should not interfere with the local government officials if they will not provide additional resources. What the national government should focus on, according to Pangilinan, is closely monitor over national agencies and institutions such as PhilHealth, which has been facing allegations of corruption and irregularities. According to the senator, the government should ensure that these agencies are performing their mandate. Presidential spokesperson Harry Roque responded to Pangilinan, adding that the government is doing its best in fighting the disease.
Alam niyo naman, malapit na electionist itong si Senator Pangilinan. Di ako nagtataka sa mga maanghang na salita niya. Everyone's doing their best dahil kapag tayo po ay pumalya, baka sariling pamilya rin namin na mag-suffer sa COVID.
The House of Representatives resumes the investigation on the alleged corruption in PhilHealth. High-ranking officials signed a waiver that would allow to view their bank accounts. Ray Pelayo tells us why.
Investigators may see the transactions recorded in the bank accounts of 14 PhilHealth officials after they signed a waiver on the bank secrecy law. Those officials include PhilHealth Insurance President and CEO Ricardo Morales, Executive Vice President and Chief Operating Officer Arnel De Jesus, 6 Senior Vice President and Vice Presidents. This is their response to lawmakers' challenge during a previous hearing on proving their innocence on the corruption allegations.
Binibigyan nila ng karapatan kung sino man po mag-iimbestiga na tingnan yung kanilang mga bank accounts.
During today's hearing on the House Committee on Good Government and Public Accountability and the Committee on Public Accounts, Laguna Representative Dan Fernandez raised the number of signatories before a fund like Interim Reimbursement Mechanism or IRM could be released, and he found there are 8. The lawmakers said the numbers should be trimmed down to 3 to abide by the Republic Act 11031 or the Ease of Doing Business.
With so many signatories in the processing of this IRM, doon po lumalabas yung fraud. This is a design for fraud.
During the hearing, it was revealed that PhilHealth's Auto Credit Payment Scheme or ACPS is not authorized by the Bangko Sentral ng Pilipinas. Through the Auto Credit Payment Scheme, PhilHealth can transfer funds to a recipient like the agency's regional offices.
Humingi po ba kayo ng authority sa Bangko Sentral bilang operator ng ACPS? Yes or no? Yes or no lang po?
No, sir. No.
Are you designated the right payment system by the Monetary Board or ng Bangko Sentral? Yes or no? Were you designated by the Bangko Sentral? Kayo po ay sinabi ng Bangko Sentral na okay, i-operate nyo yung payment system na yan. Binigyan ba kayo ng authority?
None,
Hindi
sir.
din.
Apo.
In other words, Mr. Chairman, ino-operate po nila ang auto credit payment system without authority coming from the Bangko Sentral, which is in violation of Republic Act 1127.
Cavite Representative Elpidio Barsaga asked PhilHealth officials why dialysis centers and lying-in clinics are included among the recipients of the IRM while it should be for COVID-19 cases. In response, Dr. Israel Francis Vargas, PhilHealth's Senior Vice President for Health Finance Policy Sector, the hospital's entire operation is affected by COVID-19 cases.
Ang pinanggagalingan po namin dito is yung pong COVID, yung pong kabuuan ng operasyon ng isang ospital ay maaapektuhan ng COVID cases. Kung kaya po lahat po ng pagkakasakit, including the dialysis and even the maternities that should not be going to the hospital right now because of the COVID, maaapektuhan din po.
Ray Pelayo, UNTV News and Rescue. We serve the people, we give glory to God.
The Philippine Red Cross or PRC may suspend its COVID-19 testing on individuals whose payments will be charged to PhilHealth should the agency fails to settle its balances amounting to over 700 million pesos. According to PRC Chairman and CEO Senator Richard Gordon, the PhilHealth has been slow in its payments following the 100 million peso cash advance payment. The government has earlier signed an agreement with the PRC to help in leading the COVID-19 testing in the country, especially among overseas Filipino workers and government frontliners. Gordon says should PhilHealth fail to pay its balances, it will force the PRC to stop its operations in its testing centers in Manila, as it will prevent the PRC to replenish their dwindling supply of COVID-19 test kits and pay their medical technologists and staff. He adds they will also not be able to open their newly built laboratories in Bacolod, Zamboanga, and Cagayan de Oro. However, the senator clarified that the PRC will continue to accommodate walk-in individuals who will pay for their COVID-19 testing. In a statement, PhilHealth says as of August 12, 2020, they have already paid 500 million pesos to the PRC for more than 115,000 RT-PCR tests it conducted. PhilHealth explained they have received the payables from the PRC amounting to 716 million pesos in 3 separate billings last week. According to the state health insurer, the balances will be processed in accordance to the limit set by the board of directors at 910 million pesos and also subject to additional allocation as may be approved by the board. Senator Gordon has yet to comment on PhilHealth's answer. Now, here's a glimpse of what's the weather like in parts of the country. A low-pressure area will bring scattered rains in various parts of the country. State Weather Bureau Pagasa says as of 3 p.m. today, the LPA was located 315 kilometers east-southeast of Hinatuan, Surigao del Sur. The LPA, or the southwest monsoon, will bring cloudy skies with scattered rains and thunderstorms over Ilocos Region, Cordillera Administrative Region, Cagayan Valley, Mimaropa, Western Visayas, and Mindanao. Meanwhile, the rest of the country will experience partly cloudy to cloudy skies with isolated rain showers, mostly in the afternoon or evening. Possible flash floods or landslides may occur during severe thunderstorms. No tropical cyclone advisory is issued.
The Department of National Defense opposes the possible granting of amnesty to a recently arrested Abu Sayyaf group leader. Our police correspondent, Leia Ilagan, explains why.
Reports have been circulating that Abu Sayyaf group sub-leader Abdul Jihad Edang Susukan allegedly had surrendered to Moro National Liberation Front or MNLF chairman Nur Misuari. For Defense Secretary Delphine Lorenzana, Susukan must pay the price for all the crimes he and his group had committed, which include killing more than 30 soldiers and even decapitating some of them. The Department of National Defense resists the possible granting of amnesty to Susukan. The Armed Forces of the Philippines, for their part, say they will support the court's decision on the matter.
The matter of amnesty is beyond the Armed Forces of the Philippines to comment on, since that is a legal matter. It is an issue, the resolution of which is rightfully vested on the political decision makers to pass upon based on the recommendation of the Department of Justice. And whatever that decision will be, the Armed Forces of the Philippines will support.
Even for Philippine National Police Chief, Police General Archie Gamboa, the discretion whether Susukan is qualified for an amnesty remains with the court.
It is not within the PNP powers to grant the same. No, that's, I think, purely vested on the executive, or I think through a legislation in the legislative branch.
The PNP and the AFP will seek a court order to give the military custody over Susukan.
For security considerations and Idang Susukan being a high-value individual, the AFP, through the Judge Advocate General and the Philippine National Police, through the intelligence group, will file before the court a joint motion to transfer custody of the accused Susukan to the Armed Forces of the Philippines.
We are now preparing our report to the Honorable Abdul Moin M. Pakam, presiding judge of RTC Branch 5 of Bungao, Tawi-Tawi, on the implementation of the warrant of arrest issued by that court against Abdul Jihad Susukan, alias Idang, together with the Armed Forces of the Philippines. We will seek the disposition of the court to transfer the venue of detention of the accused from the Philippine National Police to the Armed Forces of the Philippines.
The PNP chief adds they will leave the decision to the court if MNLF chair Misuari must be held liable for harboring a terrorist. Susukan is currently detained at the PNP Custodial Center after his arrest in Misuari's residence in Barangay Maa, Davao on Thursday night. Leia Ilagan, UNTV, News and Rescue. We serve the people, we give glory to God.
Meanwhile, Malacanang believes that a criminal liability against Misuari for Susukan's alleged surrender to the MNLF chairman is highly unlikely. Misuari turned over Susukan to the Davao City Police office after facilitating the negotiations between the two camps. Based on reports, Susukan remained in Misuari's residence until Tuesday last week, 2 days before his arrest.
Ang alam ko po ay he arranged for the surrender, no? So in terms of criminal liability, medyo highly unlikely po kasi parang he really arranged for Susukan to surrender. Hindi po nahuli si Susukan dahil tinatago ni Nuno Misuari. Parang hindi po ganon. Parang he really arranged that authorities will apprehend Susukan in his residence on that given day.
Meanwhile, a dedicated COVID-19 facility in East Avenue Medical Center opens today despite the lack of healthcare workers. The hospital management clarifies they will still accept non-COVID-19 patients. Asher Gadapan Jr. details why.
A new facility in East Avenue Medical Center intended for Women's Wellness and Brain Center was converted to a dedicated COVID-19 treatment facility exclusively for severe and critical cases. It houses 220 isolation rooms and 30 intensive care unit or ICU beds. Although EAMC requires additional 900 health human resources for the full operation of its facility, it opened its doors today. According to EAMC spokesperson Dr. Dennis Ordoña, they have been expecting healthcare workers from the national government for the COVID-19 facility. But due to delays, they were obliged to designate to the facility some of their medical personnel who handle non-COVID-19 patients in the meantime.
Kung magbubukas kasi ng bago at hindi pa naman po agad-agaran ang augmentation ng human resources mula sa national government, mahahati pa rin po yung serbisyo sa ngayon, sa simula lang naman po.
Despite the challenge in the number of health workers, EAMC assures they will continue to accept non-COVID-19 patients.
Yung existing na building po natin, yun po ay in the long term gusto pa rin natin po na maging magsilbi para sa ating mga non-COVID patients na kailangan pa rin po ng mga medical na atensyon.
The National Task Force Against COVID-19 says more government hospitals are set to increase their bed capacities for severe and critical COVID-19 cases, as hospitals in Metro Manila are currently in dangerous level at 74% occupancy. The Quirino Memorial Medical Center is scheduled to add 50 ICU beds and 100 isolation and ward beds for severe and critical COVID-19 cases. The Philippine General Hospital, Lung Center of the Philippines, and Quezon Institute also plan to augment their bed capacities to further help their patients. Asher Kadapan Jr., UNTV News and Rescue. We serve the people. We give glory to God.
Let's now take a closer look at the updated count of coronavirus cases in countries worst hit by the pandemic. The USA remains on top of the global count with more than 5.4 million confirmed COVID-19 cases now, followed by Brazil with over 3.3 million, and India continues to struggle with its more than 2.6 million cases, but with almost 2 million recoveries.
New Zealand reports 9 new confirmed cases of COVID-19, all from the Auckland cluster. 7 of those cases have a confirmed link to the cluster, while 2 others are still being investigated if they have a link to the cluster. Meanwhile, 86 people linked to the Auckland cluster, including 36 positive cases, have been moved into a quarantine facility. Director General of Health Dr. Ashley Bloomfield said people are encouraged to move into a quarantine facility where that was helpful, such as families where some had tested positive while others had not. Nationwide, the total number of active cases is 78. Of those, 58 are in the community cluster and 20 are overseas arrivals that have been contained in quarantine or managed isolation since they flew in. Also in New Zealand, the decision to delay the 2020 general election to October 17 was partly about voter and candidate safety. According to Prime Minister Jacinda Ardern, it is also partly to allow parties to campaign fairly. Ardern says that she wanted to restore some sense of political certainty amid the ongoing COVID-19 crisis. Elsewhere in Australia, the New South Wales government apologizes to anyone who experienced any additional hurt, stress, and trauma due to the mistakes made by NSW Health. In a statement released today, NSW Premier Gladys Berejiklian says that over the weekend, she reviewed the reports of the Special Commission of Inquiry into the Ruby Princess, and it is clear mistakes were made by NSW Health and others. The findings say that after completing an 11-day return cruise to New Zealand, passengers were allowed to leave the ship at Sydney Harbour and catch public transport and domestic and overseas flights home. The inquiry report also found NSW Health had mischaracterized the ship as low risk and should have tested sick patients immediately. A public inquiry into the Ruby Princess outbreak concluded last week that NSW Health officials made inexcusable mistakes when they allowed about 2,700 passengers, 120 of whom were feeling unwell, to leave the ship on March 19. Premier Berejiklian says that she recognizes the hurt and suffering these mistakes caused, and I apologize for that. She added there are no systemic failures to address. Ms. Berejiklian said given the ongoing pandemic, she expected the recommendations relating to NSW to be implemented as soon as possible and work to begin immediately with the federal government on the other recommendations. Meanwhile, Lebanon's caretaker health minister has called for a 2-week lockdown. This move comes after a resurgence of COVID-19 cases in the wake of the devastating explosion at Beirut port on 4 August. On Sunday, the Lebanese Health Ministry reported 439 new coronavirus infections and 6 deaths. The UN Agency for Palestinian Refugees, meanwhile, confirmed that 4 people with COVID-19 had died at camps in Lebanon and warned that things may get out of control. Japan suffers its biggest economic contradiction on record in the second quarter of the year.
According to Takeshi Minami, chief economist at Norinchukin Research Institute, the big decline can be explained by the decrease in consumption and exports. Now, policymakers are under pressure for bolder action to prevent a deeper recession. The world's third largest economy shrank 27.8% in April to June. Government data showed today marking the biggest decline since comparable data became available in 1980, the slightly bigger than a median market forecast for a 27.2% drop. Japan has also seen 3 straight quarters of declines, which knocked the size of real gross domestic product or GDP to decade low levels. Japan's real GDP shrank to 485 trillion yen. That's the lowest since April to June 2011, when Japan was still suffering from 2 decades of deflation and economic stagnation. According to Minami, he expects growth to turn positive in the July to September quarter. But globally, the rebound is sluggish everywhere except for China.
Some good news, another Filipino has just made us proud. Ernest John Obiena cleared 5.70 meters for a podium finish in the 2020 Monaco Diamond League on August 14 local time. The 25-year-old Filipino pole vault sensation tied with Belgium's Ben Broders. But the Belgian came in second for clearing 5.70 in his first attempt, while EJ needed a second attempt to record his season-best clearance to make it to third. Armand Duplantis of Sweden won gold. Our very own EJ has actually secured a ticket to the Tokyo Summer Olympics, which has been deferred for a certain date next year, but the Asian champion vows to keep doing better and carry the flag proud in his every jump over the bar. EJ is currently ranked the world's 16th best in men's pole vault. And those are the reasons behind the news, August 17, 2020. I am Horlin Delgado.
Reasons we deliver to you as they unfold. I am Elsie Marcos.
Because we need to know. We will always ask why. I'm Angelo Castro III. We serve the people. We give glory to God.